Hey guys, this is Michelle with part 2 of the surface anatomy of the hip and gluteal region. Just really quickly, I wanted to go over the posterior iliac spines. So this portion in red is the posterior superior iliac spine. And the significance of this is that it kind of serves as a guideline or a guiding point for locating the S2 vertebra. So this is the line right here for the S2. And if we move inferior to that, this smaller notch right here is going to be the posterior inferior iliac spine. So now we're going to move into the gluteus maximus. So your gluteus maximus is the largest gluteal muscle, and it's located on the posterior aspect of the coxofemoral joint or the hip joint. So it's this muscle right here. And if you were to do a ventral gluteal IM injection or intramuscular injection, the way to find the injection site would be to have your patient lie on their side and have them flex their thigh at the hip. You would then find the greater trochanter and place the palm of your hand on it. You would have your second digit placed on the anterior superior iliac spine, and then your third digit or your middle finger you would move along the iliac crest towards the posterior end of the patient as far as you can go. So this creates a kind of V or triangle shape, and at the center of this triangle will be the injection site for the gluteal injection. So there's two other landmarks I wanted to go over. We have the natal cleft, which is medial to the gluteus maximus. It would be this line right here. And we also have the gluteal fold, which is inferior to the gluteus maximus, and it's superior to the posterior thigh. So your gluteal fold is this fold right here. Next, I'm going to go over the femoral triangle and its boundaries and contents. So there's three borders that make up the femoral triangle. We have the superior border right here, which is formed by the inguinal ligament, which we saw in the previous video. Our lateral border is formed by the sartorius muscle, the medial portion of it. And then our medial border is formed by the adductor longus muscle, the medial border of that muscle. It also forms part of the base of the triangle. So the complete base would be the adductor longus, the iliopsoas, and the pectineus muscles. And then the roof of the triangle would be formed by fascia lata. So for the contents of the femoral triangle, we'll move to this image. There's a few things to point out here. We have the femoral nerve, which innervates the anterior compartment of the thigh. So it's this portion in yellow that you see. We also have the femoral artery, which is in red, and that supplies blood to the lower limbs. We also have the femoral vein, which is pictured in the darker blue. And this vein, the great saphenous vein, drains into the femoral vein. Lastly, we have the femoral canal, which is that little portion that you can see in purple or pink. And it leads to the deep lymph nodes and vessels. So the clinical importance of the femoral triangle is when we have a femoral hernia, which is when part of the bowel sort of pushes into the femoral canal, which is again the pink or purple portion, and it sort of forces itself underneath the inguinal ligament, and it's oftentimes you need surgery to correct it. But the way to recognize it would be, if we move to the femoral triangle here, you would notice a bulge or a lump in this triangle, particularly underneath the inguinal ligament. And that's all I have for you guys. Thank you.